This real experience of Aussies going through this journey to conceive. The country's most heartwarming and emotionally powerful TV show is back for season 3, Big Miracles. This season includes a solo mum going it alone, a woman born without a uterus who receives a priceless gift from her sister. Just remarkable stories. And joining us this morning, Fertility Specialist at IVFAustralia. She's a gyno and advocate for women's health and a busy mum of 3, Dr Kath Whitton. Thanks so much for coming on the show.
Thank you so much for having me. It's great to be here.
Now, Kath, 1 in 6, that's a lot more common than I reckon most people would realise. What actually causes infertility?
Yeah, it is pretty common. If, you start talking about it, you realise that, your neighbour's gone through it, your uncle's gone through it, your cousins have gone through it, and friends, like everyone knows someone.
Yeah.
So many different causes. It's really variable. In fact, 50% of the time we find a female factor, 50% we find a male factor.
Right.
And in a bunch of couples, there's, a combination of these factors. There's so much that can contribute. We obviously look at sperm health for the man, and for the woman it's things like her egg health, her uterus, but largely it's often general lifestyle things that we're looking to change and modify as well.
I'm 37. I have so many girlfriends my age going through this challenge. It's so physically and emotionally trying for them. I know there's this feeling of helplessness, like there must be something they can do. Doctors must be missing something. What can couples or people experiencing fertility issues do that's within their power as a start before going down the road of IVF?
Really good question. So number one is to just get your fertility checked early. So as soon as you start thinking about wanting to try for a family, go and see your doctor. Have your fertility checked. That will often mean some blood tests for both of you. For the man, getting a sperm test, and for the woman, getting an ultrasound of the pelvis as well. So you're never, ever going to regret checking it early, but you may very well regret not getting it checked earlier. And never underestimate the impact that lifestyle can have. So healthy diet, exercising, maintaining a healthy weight range, not smoking. Smoking is so bad for eggs and for sperm.
Right.
So I think people, when I often talk about those things, people kind of think, oh, boring. But truly, it plays such a big role. So being as healthy as you possibly can.
Now, Kath, when I knew you were coming on, I read an article in the local paper here, The Advertiser, and I didn't realise this either. It's $13,000 up to $13,000 up front for standard IVF and another $11,000 for elective egg freezing. This is a very expensive exercise.
It can be expensive, you're quite right. So it's not for everyone. We're very lucky in Australia, however, in couples that are experiencing, or people that are experiencing infertility, you do get around about 50% of that upfront cost back from Medicare. We're so lucky to be supported by Medicare. With elective egg freezing, if there's not a medical reason for it, and medical reasons include things like having a really low ovarian reserve or something like endometriosis, which can severely affect a woman's fertility. If it's only elective, then unfortunately she's not eligible for a Medicare rebate. But if it is for medical reasons, she will attract a Medicare rebate.
And what kind of support is there to help manage people's mental health while they go through something like this? Because I think women, as the ones whose bodies are doing the conceiving and the growing of a life, can put so much pressure on themselves, blame themselves for things not going as planned. And, some women are going through these crazy rounds of IVF. They might wake up after an egg retrieval and be told they have no eggs. After all that process, it really takes its toll. How much of this is helping people through this process mentally as well as scientifically?
Yeah, good question. It can be a really, really rough shot for some people. I think the vast majority of doctors that I work with and nurses that I work with are so sympathetic of this, and so we do try and help and hold people's hands through the process. But a lot of good IVF clinics, certainly at IVFAustralia we do, and I'm sure a lot that are local to Adelaide and SA have counselling services available as well. Freely available to any patients that we're helping, just to talk through these issues, because it is so common. We also provide little peer support groups and things as well. So knowing other people that are currently going through this process and bouncing ideas off them can be helpful.
Kath, I've just got some questions about how it affects the male in this situation and maybe some tips how men can support their partners in this process. I'll get you to stay on the line for us. We'll be back with Dr Kath in a tip.
SAFM's Bernie and Emma G.
Best mates for breakfast.